Why would we want to do a CT scan? Well, a CT scan is more sensitive. It allows us to pick up smaller nodules, 1 to 2 to 3 millimeters, so much, much smaller. Hey everyone, welcome back to the vlog. I am Dr. Sue, cancer vet, and I've been a little bit on a break, let's just say, because of COVID-19 and the quarantine, and I'm in the Metro New York area, and that has been the epicenter. I am healthy, but it has definitely been a little bit of craziness. So with homeschooling and all of that good stuff, and just some of the craziness going on, I have taken a little bit of the break. But I wanted to hop back on and kind of talk about one of the cases that I've seen recently, which is actually a long-term patient of mine, Mackenzie. She is a golden retriever who I'm treating for mast cell tumors, but this vlog is not about mast cell tumors. Today, I wanted to talk about the disadvantages, the pros and the cons of chest x-rays versus CT scan for looking at nodules, masses in the lungs. And the reason this came up is Mackenzie, she's had about 5 mast cell tumors. And guys, remember, I'm going to put links below about mast cell tumors. Those are those skin tumors. She's had about 5 mast cell tumors going back to 2015. So 5 years of mast cell tumors. And most of them have been good. So we've done surgery, we get clean and wide margins, and that's all she's needed. One of them was one of the more aggressive ones, and I think that was in 2016. And we did treat her with about 6 months of chemotherapy. And her parents, they know that monitoring for new lumps and bumps is very important. One of my favorite vlogs is vlog number 73, and that's where I talk about doing that monthly lump and bump exam to look for lumps and bumps for your dog. Not just if your dog has had mast cell tumors like Mackenzie, but to evaluate for lumps and bumps on a regular basis. Because you can't look at a mass, I can't look at a mass and know what it is. But Mackenzie's parents are, definitely on top of it. And recently they found a new mass in the sternum area, and sort of the pectoral region of Mackenzie. They went to her vet, they did an aspirate and confirmed that she had a mast cell tumor and she was going to have surgery. And then they were petting her, and sort of over in the her arm area and her front leg, her distal leg, they found a new lump and bump. So they decided to bring her to me about 2 weeks ago for an aspirate and to do some staging test. What is staging? And that's a term that you'll sometimes hear. That is when we look to see if a cancer has spread. And I know I'm talking about mast cell tumors. Where do mast cell tumors spread? They typically spread to the lymph nodes, the liver and spleen, and the abdomen, and sometimes the bone marrow. Not typically the lungs. And I told you this video was going to be about spread to the lungs. So cancer that has metastasized to the lungs, right? Well, Mackenzie was there, and I aspirated her new mass. I looked at the cells under the microscope and confirmed that it was a mast cell tumor. We did an ultrasound and no evidence that her cancer had spread to her liver and spleen. So that was great. But we also did chest x-rays, and I do recommend periodic screening of the lungs to make sure cancer hasn't spread there for general health screening. And she's a golden, and that is a high-risk cancer breed. It doesn't mean if your dog's not a golden, they shouldn't have routine chest x-rays. I recommend chest x-rays at least twice a year for middle-aged and older dogs. And we've been doing this very regularly for Mackenzie. So about 2 weeks ago, we did those chest x-rays on Mackenzie. And what did we see? I saw about a 9 millimeter nodule on one of her views on her x-rays. So that's not very big. It's about this big. So 9 millimeters is about the size of an M&M, about the size of a pea. It's actually the size that I recommend, for those lumps and bumps, if the mass is the size of a pea and been there a month, to do an aspirate. But that was what we saw on her x-rays. And so the question is, what do you do? So typically, when we do chest x-rays, what's the issue? What's the problem? We want to see that nodule on at least 2 of the 3 of the views of the x-rays, because x-rays are a flat picture of a 3-dimensional dog, person, or cat, right? So you're taking a flat picture of a three-dimensional object. And with the two views at 90-degree angles, you're trying to see the object, the nodule in the lungs on two views. And we only could see it on one view. So the question was it really there, or was it obscured by something else? Because again, when you're taking an x-ray of the lungs, it could be in some of the parts of the lungs, the heart's in the way, or other ribs and muscle, legs, muscle from the legs and things like that. So we can only see it. So when I called our owners, what are the options to do if you see a nodule in the lungs? You can do a couple of things. You can wait and repeat those chest x-rays in 2 to 3 to 4 weeks, and we talked about that. Or we could do a CT scan. Why would we want to do a CT scan? Well, a CT scan is more sensitive. It allows us to pick up smaller nodules, 1 to 2 to 3 millimeters. So much, much smaller. Well, that sounds great. Why wouldn't we do CT scans all the time? Well, they, of course, have their disadvantages as well. It's a much more expensive piece of equipment, so it's a much more expensive diagnostic. And unfortunately, it requires anesthesia in dogs or heavy sedation. So that's going to add to the cost as well. So it's a much more expensive procedure. And, if your dog has an anesthetic risk or something like that, you want to talk it over with your veterinarian. So there's going to be pros and cons. But the pro is that, again, it allows us to pick up much smaller nodules. And it's a three-dimensional picture. So it's not a flat picture. It takes slices, much smaller slices, through the dog, cat, or person, and allows us to see those nodules. You can see the nodule in the lung. You can see where the heart is. You can see where exactly everything is. So for Mackenzie, it allowed us to confirm this 9 millimeter. It was actually confirmed to be 9 millimeters to 10 millimeters, so a centimeter nodule. And we saw at least another 1 to 2 other smaller nodules that were on the official report read out to be about 5 millimeters. So again, it allows us to pick up these other nodules as well. So again, those are the pros versus the cons. So obviously you're going to want to talk to your veterinarian about, should we be doing chest x-rays? Should we be doing a CT scan? If I have a pet that has a complicated mass, maybe over the chest wall, and we need a CT scan for surgery to plan the surgery, I'll be doing a CT scan of the lungs as well. But, on a routine basis, most of the time we're doing chest x-rays to screen the lungs for cancer. And then if there's a questionable nodule, we may consider doing a CT scan. The other thing that the CT report allowed us to see for Mackenzie is we were able to find what we think is the primary lesion. So in her first lumbar vertebra, they found a lytic lesion. So we think that is likely to be her primary lesion. Sometimes, you're not going to catch the primary lesion depending on what area of the body you're doing the CT scan. But in this case, it gave us that information as well. So the CT gave us that information. The other areas of the body that I think CT is super helpful for, just as a little bonus, is the head and neck area, because that is just an area where skull x-rays, just flat pictures of the head and neck of the dog, just really are not useful in terms of trying to be able to see a mass or see what's going on. So, for me, if a dog needs imaging of the head and neck area, CT is really superior in what we're going to pick. And, so if we're looking for an oral tumor, nasal tumor, those are really, if we're trying to evaluate the lymph nodes in the head and neck area, CT is definitely going to be the imaging test of choice. Often for brain tumors, MRIs are going to be better, just a better way to image those. But love CTs for the head and neck area. We can do them for the abdomen as well. So for the abdomen, we can do abdominal ultrasound, which again, don't usually require anesthesia. But again, if I have a patient there I'm CTing the chest, I'll often will CT the abdomen as well and just do it all as one set of images. So that's it. That's really sort of the rundown of chest x-rays versus CT scans. So again, just to summarize, why we like chest x-rays is they're less expensive, and it gives us preliminary information. Just remember, when your veterinarian says, or your oncologist says, they're clean, there's no cancer spread, there could be smaller nodules that we missed, but we like them because they're easy to do. Most practices can do them, and it just is a nice screening test. But there are disadvantages. We can miss those smaller masses, and we can't, because it's a flat picture, we don't see all parts of the lungs, especially when we're screening the lungs. The CT scan, again, can pick up smaller masses in the lungs, but again, they're more expensive and require anesthesia. So if I had my druthers, I of course would do a CT scan if we didn't have to worry about cost and anesthesia. But in the real world, we have to think about these things. So talk to your veterinarian, talk to your oncologist about your pet, your dog, your cat, what's going on with them, and the pros and cons, and hopefully we can come up with a plan for them. Thanks so much for watching. It was good to be back. I hope that you found this one useful. I'm going to try to hop on here on a more regular basis now that things sort of seem to be settling down. Not quite sure what normal will be under our new normal, but hopefully I'll get back to normal soon. I don't think I've ever been normal. Thanks so much for watching.